Welcome to Pediatrics. First aid and safety of kids. So we'll be talking in two parts. First is injury prevention and then next is first aid of injuries. In injury prevention, one of the most common injuries babies get is burns. So there are a few tips. One is cook with care, which we all know. Second one is be careful with microwave ovens. If it is you take out something, you leave it open, baby may stick their hands into it, can cause problems. The bowl which is taken out, babies may go and catch it, can cause problems. Never keep the utensils on the edge of the table or slab because they may not be able to see it. They just put their hands over it, pull it down, it will fall over them. So never keep especially the bowls containing hot food or water on the edge of the table or slabs. Keep it close towards the wall. Never put the kids on table or slabs. They usually crawl and go into dangerous areas, the stove and other hot objects. Before giving a bath, ensure the water temperature. You should dip your hands first and then ensure the temperature and then only pour water on your kid. Next is electrical safety. The plugs should be kept closed, and now we know that most of the plugs have got safety features. Next is make sure that the wires are well insulated. After wear and tear, there may be defects, and one of the commonest injuries is from a damaged wire. Drowning injuries. Injuries from water bodies is one of the most dreaded problems that we face because that can happen even at home. Kids should always be supervised when near a water body, which most of the parents do. The problem is when we leave them unattended for a few minutes just prior to bath. You keep water ready in a basin and the baby is kept there. You suddenly remember that you have not taken the towel to wipe the baby. You go to take it and then suddenly you see the baby in the basin or fall into the bucket and things like that. So these injuries are not very rare. These accidents are not very uncommon. So ensure that you are ready for a bath. The water is ready, the towel, mat, everything is ready, and then only bring the baby there. Never leave the baby unattended near a water body or even a bucket of water. Falls, tripping and falling. This is something which we cannot prevent at all because definitely the babies are going to fall. But there are certain things which we can try do to reduce the impact. The most commonest fall we see is slipping from the arm of the mother or the caretaker, especially at night while feeding. The babies tend to take rest during daytime and feed more at night. During daytime, we do our household activities and then we are too tired to stay awake at night. You take the baby, try to feed, you sleep off, and the baby slips and falls down. So ensure that your timetable is adjusted according to the babies in the initial weeks of life. Once they start rolling over, fall from the cot is another common injury. So once they roll over, you feel that keeping a pillow is good enough for their safety. But what happens is they roll over the pillow and they fall from a higher point. So ensure that that is not done. Either remove the cot, put the baby on the floor, or keep the cot, but baby is nursed, or you can keep railings on around the baby's cot. So ensure that the rolling over time is one of the most commonest time when babies fall and have injuries. Ensure that that doesn't occur. Walker related accidents. That is the time around 9 months onwards the baby tend to walk. So put the child in a walker. First thing, it is effortless. The baby can move around just by using toes. The walker runs with the wheels below that, and independent walking gets delayed. That is one problem. That's a major issue. Second thing is walker-related accidents. They trip and fall over the steps. They go and hit the walls. So walkers are better avoided. Never allow running around inside the house. There are furnitures, curtains, cushions, the strangulation injuries, trauma injuries. All these things can occur. So never allow them to run inside the house, and also never allow them to jump on beds or furnitures because the cushion effect is beyond their control sometimes, and they may go and hit the walls or the neighboring objects. Falling from staircase is another issue. So close the staircase You have got temporary arrangements available now. Close the staircase, never allow them to climb unless supervised, and the railings in between should be close enough that the baby cannot stick their head out of it. Other thing you can do is make a temporary blockage for all the gaps of railings until the baby is quite big enough. Supervise their sports activities whenever possible. So these are the measures which have to be taken to prevent falls when the child is too small. Another common accident inside the house is poisoning and foreign body ingestion. Always keep the medicines, especially where there are elder people, keep their medicines locked away. Do not keep it within the reach of the child, because what happens is, it's a very curious thing. Only adults do it. They are not allowed to touch. And then when you move this side, that side, they tend to take it. Sweet medicines of babies, cough syrups, all these things, they tend to have it. So keep them in a safe place. Keep poisonous items and medicines off eatable containers. Like floor cleaning solutions are kept in 7-Up bottles. These are all common mistakes we do. They have this attraction, especially after seeing advertisements, and whenever they get hold of it, they tend to drink it. So make sure that that doesn't happen. Never should a dangerous object be kept in a container of eatables. Ensure correct dose of medicine is given to the baby. The strength, especially paracetamol, it comes in 2-3 strengths. The drops come in a particular strength. Syrup comes in 2 strengths. So ensure the strength of the medicine and dose of the medicine before giving it. Dispose of unused, unneeded, expired medicines. Never keep it there. Ensure small pieces are not left unattended on the floor. Like toys, the small parts can fall off, and the babies tend to do mouthing, tend to put everything inside the mouth up to 2 years of age. So that is one common problem. Avoid nuts and berries till 1 year of age, because they cannot probably handle it, and it can swell when it is dipped in saliva. So that can cause obstruction if it is getting stuck somewhere. So poisoning and foreign body ingestion, very common. Be careful. Toy safety. Toy safety is another thing. There are age appropriate toys for babies. Whichever toy, ensure stuffed toys are washable, because it can hold a lot of dust and cause asthma as exacerbation in vulnerable kids. Avoid toys with long strings due to risk of strangulation. Avoid toys with sharp edges and small parts, because as mentioned earlier, ingestion and injury from the sharp edges. Be extra careful with battery operated toys. If you see this toys of small babies, it's usually kept under safety of screw, because baby should not be able to dismantle it easily and swallow it. Especially the ones with nickel the watch batteries, it can cause perforation if ingested. The paints used in baby toys should be lead free, and the art materials used should be non-toxic. Next is play safety. When you're playing with the kids, there is a tendency to pull them with the palms. So that can cause pull the elbow, dislocated shoulder. So always lift the baby, putting your hands below the axle and never pulling the palms. Never lift your baby above your head. Sometimes you may lose control and the baby may fall from a higher point. So it can cause grievous injury. So ensure that while you're playing with the baby, ensure play safety. Road traffic safety. We should all be using footpath. We should be walking on the right side. We should teach the kids to cross the road. We should be walking on the right side. Before crossing, we should look onto your right first, left, and then again right before crossing the road. We should be using protective gears and helmet while using cycle, roller skates and skateboards. The next is car safety. So this is one neglected area in this part of the world. 0 to 2 years, the kids should be always put on a baby seat in a car. Usually what happens is the side passenger holds the kid on their chest, and whenever there's a braking, if you're not putting the seat belt, both of you go and hit the shield, or if you have put the seat belt, the baby gets thrown away from your hand. If the baby is inside the seat belt, there's a risk of strangulation. So 0 to 2 years, the baby should be put inside a baby seat in a car, and it should be kept facing backwards in the center of the back seat and with the seat belt. So Baby seat, center of the back seat turning backwards. Babies may cry initially, but they get adjusted very quickly. So after discharge from the hospital, when you go, along with the baby care products you buy, if you are going in a car, ensure that you are buying a baby seat and the baby is put in that. 2 to 5 years, the same baby seat can be used but turning forwards. Middle of the seat, back seat, facing forward, same baby seat. 5 to 8 years, baby seat can be removed, but you should be using booster seats to elevate the baby, because the baby is sitting on the back seat, again center, because that is the safest point inside the car. And until you have the baby slightly elevated, the seat belt you are going to put is going to go through the tummy or through the neck, the two ones. So it should be going through the chest and your lap. So the baby's height should be adjusted with a booster seat while placing the baby in the back seat. For 8 to 12 years, usually babies are quite big enough to have a proper sitting seat belt. So again, ask them to be seated in the back seat, but can be used, the side seats can be used, and a proper fitting seat belt can be used. So proper fitting seat belt means it should be going over the thighs and the chest and not over the tummy and the neck. 12 years plus, the baby can be put in the front seat and with the seat belt on. Why the front seat is avoided in babies before 12 years is because until then the baby's height is less. The airbags will come and hit the baby's face, and the impact may not be very huge, and the injury may not be very huge, but the airbag which is getting ballooned can cause suffocation and injury to the baby. So ensure road traffic safety. So now we have learned to prevent injuries, but in spite of all the efforts, there may be accidents occurring. How to give first aid for each and every one of them. So the commonest one is trauma. If it's a blunt trauma, definitely there is some swelling which is going to appear. You can keep ice pack to reduce this reaction. Never try to rub. Rubbing will cause tissue injury, and it is going to probably cause more injury than the primary trauma itself. So ice packs allowed for blunt trauma, nothing more than that. If it's a laceration, if there is a wound, wash with soap and water, keep it clean, and if there is bleeding, apply pressure to control bleeds. Even if it's a little bit profuse bleeding, don't worry, keep on applying pressure and take the person towards a medical facility. If you have a knocked off tooth, the same principle apply. To control the bleeding, apply pressure. For applying pressure, what you do is give a clean cloth to bite, and the tooth should be taken as clean as possible to a dentist to see whether something can be done. If you have a broken or dislocated bone, don't fiddle with it, just immobilize that area and get immediate medical attention. So now if you have a nosebleed, keep the head a little bit forward so that whatever bleeds occur is going outwards. And if you hold the head backwards, there is a risk of aspiration of the blood which is flowing in. The nasal areas of like tremendous blood supply, and the bleeding is definitely going to be a little bit profuse and scary. So what you do is prevent aspiration and pinch the nose. Same principle, apply pressure to reduce the bleeds. Pinch the nose tightly, breathe through the mouth, and prevent aspiration. The maximum you can do at home as treatment apart from first aid is giving paracetamol for pain relief. Anything more than that, get a medical opinion. Another common injury, especially in infants, is concussion injury of the brain. Trauma to the brain, they fall, they hit their head. For bigger children, bigger people, the symptoms are slurred speech, weakness, numbness over an area, disorientation, severe headache, nausea, vomiting, convulsions, excessive sleepiness, agitation, loss of consciousness. And if you examine, you may see the pupil of one eye is larger than the other. These are all features of bleed into the head, brain, and features of increased intracranial pressure. In infants and toddlers, it may not be so pronounced because the sutures are not fused, the fontanelles are open, so the features of increased intracranial pressure may not be very evident, but they have incessant cry and refusal to feed. If any of these symptoms are there, definitely get a medical help. Burns and scalds. As soon as you have an injury from hot water, steam, or from a fire, clean that area under running water. Hold the area under running water for 10 to 15 minutes. Never rub, just hold it under running water. It may just turn red, or blisters may appear, or if the burns are really deep, that area may turn black. You can apply antibiotic ointment, usually silver containing ones, and paracetamol for pain relief. And if you feel that the area is huge or the burns are really bad, definitely get a medical opinion. And applying paste, varnish, polish, paint, everything, nothing of that sort is going to help. And sometimes what happens is the removal of paste will cause more injury than the burns per se. Urtic area. It's basically rashes appearing all over the body because of allergy. Slightly elevated, reddish, blotchy, irregular borders with itchy feeling. The kids may get irritated. So it can appear all over the body. That is basically hives or urtic area. The treatment is anti-allergic medications, and you may have to get medical attention. It can be lasting for a few days. Sometimes with the medicines it comes down again, it goes up. It can stay for a few days. The risk of urtic area is similar lesions or similar reaction can occur within the body as well, and can cause breathing difficulty. So if the child is showing any signs of breathing difficulty, you definitely need to go to a casualty and get it attended. Foreign body is anything which is entering our body from outside. It can go into the eyes, foreign body eyes. What you do is wash well in tap water. Do not rub that eyes. There may be irritation for sure, but just wash with tap water, get a medical opinion. Foreign body nose, something is entering the nasal canal. Do not try to poke it and do not try to pull it out, because what happens is the nasal canal is very small. There is a foreign body, you try to take it out, but because your finger is huge or whatever you're putting it is huge, this thing is going to get dislodged more and more inward. So never poke inside the nose, get an ENT help. Foreign body, throat. We don't know whether it has gone into the food pipe or windpipe. The person is breathing and talking happily, leave him alone. Probably it is swallowed, it has gone into the stomach. And depending on the object, it may have to be retrieved. If it is a very sharp object, if it is a battery, watch battery, there is a risk of perforation, and it has to be removed using scopy. If the person is comfortable and it is a blunt object, probably it will get passed in stools within a week. Or what you can do is get an X-ray and repeat an X-ray to see where it has reached. Most of the time, blunt objects will come out through the stools. If it is a child, do not scare the child, because probably it is just inside the mouth, and you scare the child may swallow it or may aspirate it. Do not thrust your finger inside the mouth or throat. Do not panic. Slowly try to take it out, or allow the child to bring it out by himself or herself. If there is choking sign is a pointer towards this particular object, whatever it is lodged inside the windpipe, and it's a complete obstruction. So bigger children, they usually hold their neck like this. They may turn blue, their eyes may protrude. This is universal choking sign. They may struggle to breathe. They cannot cry, they cannot talk, they cannot produce sounds. It's totally obstructing the windpipe. So that is sign of choking. If it's a mild moderate choking, they can usually clear by themselves. If they are alert, they can cough and bring it out. But if it's a complete choking, no sound at all. So in that case, for adults, what you can do is Heimlich maneuver, where you hold the person from behind, fist your thumb, apply pressure over the epiphisternum, and with the other hand apply pressure continuously, so that the foreign body is dislodged. And sometimes you may have to go in for CPR also if the person is unresponsive. Then for slightly smaller children, what you can do is you can do Heimlich maneuver, but in a different position, where you kneel down and put the child on your thighs, and again apply the pressure on the epiphisternum, so that this thing gets dislodged. Aspiration in infants, the commonest one is milk. So in that case, most of the time you put the child on the shoulder, and just as you burp the child, apply a few pats on the back and If it's a just nose block, they sneeze and clear that. If it is blocking the throat partially, they may cough out and they may regurgitate and the tract may be cleared. If it is severe obstruction, especially if it is a solid foreign body, they can actually choke in a proper way without cry, without sound and things like that. In that case, what you need to do is you need to apply other maneuvers like hold the face, head and neck supported with the index and thumb and the chest supported by 3 fingers. Put the baby in prone position, head slightly downwards and apply pressure from top upwards and outwards in between the shoulder blades, not hitting the head. 1, 2, 3, 4, 5. Put the baby supine and hold the head with your right hand and apply pressure on the xiphisternum with your left hand. 1, 2, 3, 4, 5. Then again repeat until the baby starts breathing or crying. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. The medications you can use at home as a part of first aid is paracetamol for pain relief, anti-allergic medications as mentioned in urticaria or hives, nasal drops if you have nose block, and antibiotic ointment for small cuts and wounds and burns. Anything beyond that, you need to get a medical opinion. Happy parenting.